Hello, thanks for joining the South Carolina Department of Consumer Affairs, our Wednesday webinar. Our topic today is going to be medical identity theft. And we know that this can be kind of a costly problem for a lot of people, and it can be complicated depending on what's going on. And a lot of times, it can go on for months before anybody kind of really discovers that something unusual is going on with their medical identity. So we kind of want to just talk a little bit about medical identity theft, what it is, how you might be able to prevent it, and some kind of things you can do that are free steps you can take to better protect your information, hopefully prevent this type of thing from happening to you. All right, so now we'll kind of get into the heart of our presentation. And again, we're going to be talking about what is medical identity theft. For our definition, we're talking about when somebody uses your personal identifying information or your protected health information to maybe see a doctor, get prescription drugs, buy medical devices, submit claims with your insurance provider, or to get other care. So they may be using some of your information like your insurance account number, Medicare number, something like that. They're using it to do those types of things like seeing a doctor, getting drugs and those types of things. And I just kind of want to make sure as we're talking about this, you may see kind of protected health information a good bit in our presentation. Sometimes we have it listed just as PHI, so that's protected health information. And when we're saying that phrase, we're kind of talking about things that might be tied to your medical record or your payment history, and they can kind of be directly tied to a specific person or to you. And it's kind of a broad term, and it can include things like your medical record numbers, health plan numbers, even biometric identifiers. If you're using things like fingerprints or you have medical devices that are taking in various types of information, it can be kind of things like that. And so we'll be kind of using that phrase throughout the presentation. So I just kind of wanted to make sure we kind of went over that real briefly. But kind of one of the big things to kind of think of with medical identity theft is you really want to protect that information, not just because you want, not to have to pay a bill that belongs to somebody else that they may be putting onto your record or something like that, but also sometimes the medical information, if somebody else is using your insurance benefits or something like that, their kind of medical records can start to kind of get mixed in with yours. So it can kind of really create a little bit of problems with that. And it can also, like we said, kind of hurt your credit, stuff like that as well. But you really want to protect that information, not only for your financial reasons, but also, just kind of your general medical care. You don't want those records to start to kind of get mixed in with yours and, that health information to really kind of get blurry as far as what's yours and what's somebody else's. So what are some types of medical identity theft that may happen? Financial is the big one. And that's basically when somebody else is using your information to get medical help. They're going to use your name, insurance information, things like that to be able to get services under your name. It may even be something like government benefit fraud. That's going to occur when somebody's using either your government provided medical benefits, they're using that to get services as well. So they're going to try to use your government provided medical benefits for their use. Now we've got a couple of quick examples of what some of these things might look like. And as you can imagine, our example one is kind of an individual does not have health insurance, but they're going to need surgery, some type of treatment, maybe even prescription drugs. So, what do they do when they're not able to get that type of stuff? In some cases, they're going to try to use your medical information to obtain those types of services. Another example of something that might happen would be somebody working in a medical setting, and they're going to possibly submit false bills in order to collect money. And I know we had times like this that I've seen on the news occasionally here in South Carolina where there'll be somebody who works in a medical facility where they'll kind of make these false bills to try to, basically get more money from insurance companies, things like that. There are law enforcement agencies that will investigate this type of stuff. I believe the South Carolina Attorney General's office will, the FBI, the U.S. Attorney's Office as well. So if you kind of suspect that this type of thing is happening, You may also want to kind of talk to your insurance company and see kind of the steps that they want you to take as well, because you know that they're not going to want to pay for bills that aren't rightfully supposed to go to them, so they can kind of help walk you through that process as well. But there are kind of law enforcement type measures that may need to go on if this type of thing is happening with your information. And kind of our last example, quick one on this, somebody has a pre-existing medical condition, they're trying to hide it either from their employer or their insurance provider. Same type of thing. They may try to steal your medical identity, then put all that information under you instead of, you know, something that they think that their insurance might deny or something like that. So these are kind of some of the quick scenarios of situations where somebody might be trying to use your identity. And kind of what are the signs that something like this may be happening? Kind of our number one thing right there is just you get a bill that you don't expect. It's not supposed to be coming to you. So you're getting bills for services that you didn't get. And you may even notice errors in your explanation of benefits statement for services that you didn't get or prescription medications that you don't take. And kind of when we're talking about the explanation of benefits statement, that's going to be that record from your doctor that basically tells you, you know, the doctor that you visited, the date of the visit, the services that they provided, the cost of those services, how much your information or how much of that your health insurance covered, those types of things, how much you'll have to pay. So it's kind of that overall thing from the doctor's office or that medical group, and it's going to provide a lot of that information just kind of one statement right there. And another way you may kind of notice that medical identity theft is happening is if you get a call from a debt collector. It's going to be about a medical debt that you don't owe. So you're, again, getting that bill for something that you didn't do. Another thing you might want to look for is if you're reviewing your credit reports, you might see medical debt collection notices that you don't recognize. And again, we always tell people kind of take a look at your credit reports frequently. Kind of the main goal with that is once a year, but you may want to do it a little bit more than that. And we'll kind of talk about that a little bit more kind of later on in the presentation. But you know, those credit reports are going to be kind of a good way that you might be able to see things that, you know, those collection notices and things like that that may not be coming directly into your mail or something like that, but if they're attached to your name, your social security number, and your information, they should be showing up on that credit report. So that's a good way to kind of monitor for these types of things. And you might also get a notice from a health insurance company saying you've reached your benefit limit. So that would be a good sign, you know, that somebody's taking out all these services in your name, they're using your account numbers, things like that. And you may even be denied insurance coverage because your medical records show a pre-existing condition you don't have. And again, that's kind of that mixing of information that I was talking about earlier, where somebody else is using all of your records, or, you know, and then putting their information with it in to get services. Sometimes that can all kind of bleed in together and makes it hard to tell what's yours and what's somebody else's. And they're using your name and your information for all that. So these pre-existing conditions or, you know, any kind of medical history that they might have might start appearing into your records. So that's a sign that, you know, something's going on that you need to take a closer look if you're getting that type of stuff showing up in your records. So kind of what are some ways that you might be able to protect yourself? Again, you're going to want to carefully review those explanation of benefits statements that are coming out from your health plan and from your doctor's offices and things like that. And again, it's going to tell you the doctor you visited, the date of the visit, services provided, that types of stuff. You also want to monitor these billing statements from all your healthcare providers. You know, just kind of look for any unfamiliar charges, especially if it's products or pharmaceuticals that may suggest that somebody else is using that information. So you want to take a look at that. Any of these medical procedures, different types of medical products and prescription drugs, things like that. And you also want to periodically check with your physician to ensure the accuracy of your medical records. You're gonna, again, want to make sure you're looking at that, making sure it reflects your medical history and the treatments that you've received. You're gonna want to look for inaccuracies in that, and it may just be something like an inaccurate blood type, possibly, or any of those pre-existing conditions that aren't something that belongs to you. Maybe it's an allergy or something like that, but just kind of look through those and see if everything on that is actually you, or if it's something that might be a sign of identity theft. And again, don't be afraid to ask your healthcare providers kind of about what they're doing to protect your information. And a lot of times that may be digital systems that they're using. You might want to just ask them how they're protecting that personal health information, how they're securing those types of things. And you might even want to ask how they're preventing external and internal intrusions to those records. I know a lot of times, I believe our records with not identity theft, but with security breaches, are medical companies were like the second highest type of companies or industries that had these security breaches when it comes to personal information, things like that. And they do report that to the South Carolina Department of Consumer Affairs whenever there's 1,000 or more people impacted in those breaches. So that's something you need to ask your providers about, just kind of what they're doing to protect that information that they're getting. And if there is a case where there is some type of breach, like I said, if it's 1,000 people or more, they will notify our agency, and we provide that information on our website. So you can go in and look, see if there was a breach with that company, and they should be sending records to you about that breach as well. And you can kind of double check the information that they sent you with the information that we have on our website. We post those notices on our website as well. And if you go to consumer.sc.gov, you should see a little security breach tab there on the top part of the screen. Again, we'll kind of get back into ways that you can protect yourself. Kind of the big thing to do is not to share that health information with other people. And you want to protect it like you would any other sensitive information or your financial information, things like that. So you might want to shred it, protect those records that are showing up in your emails, things like that. And as always, you don't want to provide personal identifying information or your health information over the phone or email unless you can verify the person on the other end that's asking for that information. Kind of as a good rule of thumb, we always tell people if you're getting requests over the phone for that type of information, you might even want to tell them, hey, I'll call you back, hang up, and use those phone numbers that you know are trusted and verified. So you may want to hang up and then call that office directly, maybe the same way that you would go about setting up an appointment, something like that. Or if you have bills that have those, sometimes they'll have different phone numbers for their billing office or whatever. So you might want to just kind of go through your own personal records that you know are true or verified, and kind of go through that and find those contact information yourself, and not rely on those incoming phone calls, emails, text messages like that. Just kind of a good rule of thumb not to give that type of information over when you're getting those requests that you did not make. And if you use a health device or a healthcare related website or mobile app, you just kind of want to know how that company is storing and protecting that personal data. And a lot of times, like I said, that may be something where you're using a certain app or something like that that's kind of tracking different health information about you. Might be a healthcare provider, might be some kind of fitness app or something like that. Anytime they're storing that type of information, you want to know kind of what they're storing, why they're storing it, and what they're doing with that data. And as always, be careful not to overshare your health related matters on social media. And the reason we kind of say that is, you may be just kind of sharing small little things on social media, but if your account is, especially if it's set to public, fraudsters can kind of go through that and they can start kind of aggregating information about you. And depending on how often you're posting something or how many things you're posting, they may be able to kind of put together a medical identity profile, which they can then kind of use to exploit. And they're going to try to kind of pick those pieces of information apart and find ways that they can use that to kind of put bills and things in your name. So they're kind of creating their own profile about you, and then they're going to use that for their gain. And as we continue to talk about things you can do to protect yourself, you always want to protect, again, that health insurance enrollment forms, those types of things, your health insurance cards, prescriptions, even the prescription bottles. And again, those billing statements, explanation of benefits, things like that. And kind of when it comes to health insurance cards and things like that, it may also be a good idea not to carry those types of things with you all the time. I know a lot of us keep them in our wallets in case something happens unexpectedly, things like that, but just kind of think about the points of risk that you may have and decide if, those risks are worth it or not. So really just kind of think about the types of things that you carry around with you all the time and things you can do to protect that information as well, because these are all types of things that might kind of start to add up that identity thieves can use the information to kind of exploit for their benefit. And so as we're talking about protecting this information, especially when it comes to digital information, if you're keeping this stuff on your phone or your computer, one of the big things that you can do, one of them is just to update your software, keep it updated. You might even want to set up those automatic app and software updates on your phone. Those will be good things that you can do just to kind of verify that you're keeping your software up to date and that they're protecting against the latest threats that may be out there. I know a lot of software, especially in apps, they'll kind of put those updates out pretty frequently anytime that there's a security flaw that's discovered. So those are good free tools that you can use. You'll also want to set up two-factor authentication anytime that it's available, especially with such sensitive information like medical data. If your office that you're going to, your doctor's office or whatever, if they're not using two-factor authentication, you might want to just talk to them about why they're not using it. And again, two-factor authentication is usually kind of that little code that you might get sent to you in a text message. Depending on what it is, some apps will have like a little push button that will then send it to you, and you'll just get an alert that says someone tried to log in. Is that you? And you'll just say yes or no. Might be something like that. I know some medical companies will set up their stuff with like a face scan or that face ID type stuff. So it could be a variety of different ways, but just kind of make sure they're using that additional step to get into your account. And kind of the big rule of thumb with that is it just kind of makes it twice as hard for somebody to get into your accounts. So if those passwords, things like that are included in a security breach, or scammers somehow found your passwords one way or another, even if they have that password, they're not going to be able to get into your account because they're not getting past that second factor. And the last thing you want to do is you want to secure your files. So that may be kind of putting those steps on a hard drive, things like that you're putting there, making sure that all those files might have passwords to get into them, things like that. And if you're securing paper files that they're somewhere that people can't get into, maybe in a locked drawer, something like that, and that you're shredding them, things like that. So you really just kind of want to make sure that other people don't have access to those files that may have all that information about you that could lead to, your medical records or those account numbers, things like that. And again, as we talk about protecting your files and your devices, you want to require passwords. And we always tell people never use the same password on accounts. So you want unique passwords, and you're going to want to make them complex as well. So you'll use a mix of uppercase, lowercase, numbers and symbols. And kind of as a rule of thumb, longer is stronger when it comes to passwords. So the longer you can make something, the better. And again, kind of mix those other cases of letters and things like that in there as well. And really the strongest two would be long and then random. So that example down there would be a good example of that. It's several characters long. It's got some numbers in there. It's got some couple of different symbols. So it's just kind of something that is random and wouldn't be something that you could guess just by knowing you. Like example would be like not using your pet's name, something like that, or your street name, things that people can easily find just by knowing you or looking over your social media accounts, things like that. So random is best, longer and stronger, and you want to make them unique, because if somebody gets one password, you don't want them to be able to get into all of your accounts using that same password over and over. And you also kind of want to think about free public Wi-Fi hotspots. They're not secure, and anybody might be able to get in, see what you're doing while you're connected on these spots. So you want to avoid logging into accounts like your email, financial services, and your health services, things like that as well, because you're putting a lot of information with a lot of different kind of those data points about you that are your social, your medical health account numbers, things like that. So you're really going to want to avoid doing those types of things whenever you're logged in onto a free Wi-Fi hotspot. And you might also want to consider using a virtual private network if you're out and about instead of using free Wi-Fi that's going out. So a lot of phones, I know mine will have that mobile hotspot. I was just using it yesterday while I was out for work doing some stuff. So you can just pull up your phone, set that up, and then use your laptop or whatever to log in that way and get on the internet that way. Again, that would just be a little bit more secure because you're on that little private network. And if you're shredding medical documents, you might want to just kind of consider the type of shredder that you're using. We've got a little example here of the different types of cut that a lot of shredders will use. And as you can see, the micro cut is going to give you a lot more protection. It's going to shred that document up a lot of different ways, and it ends up being a lot smaller and it'll cut up in a lot of various different ways. So it's going to be harder to kind of piece that information back together. So whenever you're kind of using those documents that have a lot of medical information or a lot of financial information, you'll want to use that micro cut to take care of that process. Strip cut would probably be fine with something that you're just kind of wanting to get rid of some of that junk mail that's been sitting there that doesn't really have any information about you, and you just want to get it out of the house and dispose of it a lot easier. That's probably fine for something like that. But when you're talking about those documents that have a lot of personal information, a lot of financial information, you'll want to kind of consider that micro cut as a way to go with that. And so what should you do to kind of further this process and continue fight against medical identity theft? You want to get copies of your medical records. And again, when you get those copies, you're going to want to go through them, make sure that everything's accurate, that it belongs to you. And if you're having problems getting these documents from your healthcare providers, you can file a complaint with the U.S. Department of Health and Human Services. They have an office for civil rights that kind of takes those types of complaints. So you want to let them know if you're having difficulties getting the records that you need from those healthcare providers. And you can also obtain copies of accounting disclosures from each of your healthcare providers and your health plans. These are just kind of the records that healthcare providers keep about you, and it's looking at the information that they send other people about you. So it should give you kind of a record of who they sent that information to, the date, why that information was needed to be sent to that person or that company. So you want to kind of take a look at those accounting disclosures as well. And then you're going to, again, check for errors and contact your healthcare providers, the pharmacies or laboratories anytime you see any errors. Again, you might want to do that through paper notice. That's usually kind of the best way. So you can send them something in the mail. Certified mail's a great way to do that. You're going to want to send them copies of those documents, let them know what kind of entries were wrong, and then explain to them that it's incorrect and that you want it to be corrected. And again, certified mail with a return receipt requested, that's going to give you a record of what that healthcare provider has received and when they received it. And you also want to make sure that you keep copies of all your records and the documents you've received and sent with them. So just kind of make sure you're keeping all that tracked and you know what you've sent, what you've gotten back from them. And the health provider, the medical provider, they're going to be required by law to change any mistakes that they've found in those records, and they should be able to correct those errors within 30 days. So again, just kind of keep that in mind as you're going through that process as well if you have errors on those documents. And we know that identity thieves and scammers are out there looking for this type of information, especially medical information, is because medical care can get pretty pricey. So this type of information can have a big benefit to them if they get a hold of it. So again, anytime you're getting phone calls, text messages, emails, even looking at websites or especially clicking things on social media, kind of know scammers are out there and they're using those types of communication that we all use. So they're out there using social media, using the internet, same ways that we do, and they're using those ways to try to get information and to steal money from people. So anytime you're getting those requests, again, just kind of think about what they're asking for, why they're asking for, and if you're getting requests out of the blue from social media, email, text messages, phone calls, just kind of think, I can hang up, I don't have to communicate this way, I can then reach out knowing that I can find a way to reach out with a true and trusted contact number, something like that. So you always want to initiate that contact the first time to provide that sensitive information. You don't want to just give it to somebody out of the blue. And we know that there's a lot of scams out there and they kind of changed their tactics a good bit, but there are some red flags that we know that are common signs of any scam. And a big one with that is just kind of, they pretend to be people that we know and we recognize and that we trust. A lot of times this might be something you see on social media, or again, kind of that caller ID might show somebody's name, government agency, something like that, but they kind of pretend to be people that you know and trust, and they know if you recognize that name, you're kind of more likely to start engaging with them or something like that. And they'll typically tell you there's some kind of problem, or there might be some kind of reward for you if you take the actions that they want. So, they may say there's some kind of problem with your account and that you've got to take some kind of action to be able to fix it. So really just kind of take a look at those types of things when they're starting to come in, and know that scammers typically will say that there's some kind of emergency that needs to be resolved, and they want you to take specific actions to do that. And most of the time, they're going to want you to try to act immediately. And a lot of that is they don't want you to really think twice about it. They want you to act quickly. And they know if they've got you right there and you're kind of under that pressure to act right then and there, you're going to make decisions that you may not normally make. So you're kind of making those quick reactions in the heat of the moment. So they want you to do that, and they want you to also not really talk to anybody else. So that's kind of one of those reasons they want you to act right now, because they know if you start talking it out with somebody else, you're more likely to realize that something's not right about the situation. So those little promises that you have to act right now or something bad is going to happen, that's a pretty big sign that it's probably a scam. And they may even tell you you have to pay in a specific way, wire transfers, prepaid debit cards, gift cards, cryptocurrencies, may even be a fake check that they send to you. But they know a lot of times, especially with gift cards, cryptocurrency, prepaid cards, things like that, they're hard to track, especially once you've kind of given that information over to them. A lot of times it's as good as gone right then and there as soon as you give those gift card numbers and things like that over to people. So once you've given that away, it's as good as cash in their pocket at that time, and they know that it's hard to track, it's hard to get it back once it's given to them. So that's kind of why they like those payments. So you, especially with medical care, you kind of know, most offices aren't going to ask you to wire transfer or cryptocurrency or gift card, things like that. So especially with medical care, that would be a pretty big red flag with that, but just kind of know scammers like those types of payments, and they like it because it's hard to kind of follow up on it if something's going wrong, and it's hard to get that money back. And again, you'll want to kind of check over your credit reports quite often to just kind of make sure things are in line with how they should be. Annualcreditreport.com is the site that we recommend using. I know there's a lot of other free websites out there, but annualcreditreport.com is authorized by federal law. So the 3 credit reporting agencies are required by law to give you at least one free credit report each year. During the pandemic, they kind of changed that to 1 every week. They're continuing that policy right now for pretty much as long as they can. So they've said they're going to continue that policy. So 1 free credit report every week. There's really not much need to kind of go in there every week, but you want to check it quite often. You can check all 3 of the credit reports at once, or you can spread them out throughout a year, or however you want to do that. But you want to kind of go through those, make sure that everything's accurate. When it comes to medical stuff, you want to look through, see if there's any kind of bills that are showing up in there, any kind of medical debt collection notices that may be on there that you don't recognize. So you're really going to want to look through and make sure all the information on there, all the addresses, phone numbers, email addresses, anything like that, that they actually belong to you, that they're accurate, that they're true to you, and that any dollar amounts, especially too, listed for any of these accounts, that they're all what they should be. And if you find any errors, you can report those through those 3 credit bureaus. There's usually a button on the side if you're doing it online that will let you report whatever the account that's showing up is. And if you're finding signs of any kind of medical identity theft or any other type of identity theft while you're looking through those accounts, you might want to consider putting a fraud alert on your credit reports, and that's going to last 1 year. You can get it extended after that if you need to, but basically this is going to alert businesses that are looking at your credit that they may need to take extra steps to verify your identity, that something's happened, that there's signs of potential fraud involved, and that they're going to want to take those extra steps to make sure that it actually is you applying for that type of credit or whatever the situation may be with that. And basically, you're just going to call one of the credit reporting agencies, Experian, TransUnion, Equifax. You can call them, or you can go to their website. They have a button on there once you've logged in, but you'll just notify one of them about the fraud alert, and then they're going to notify the others. And again, it's a free process that you can do to kind of put that extra step in there. A good thing that we tell everybody to consider is the credit freeze. So basically, you'll set this up on your credit reports, and it's going to prevent new lines of credit from being reported in your name. So things like credit cards, loans, things like that. Nobody's going to be able to go in, even apply for like a new phone line maybe, if they're running credit reports for that type of stuff. So nobody's going to be able to open up those new lines of credit in your name. You're basically stopping other people from using your information to open up these accounts. And it's free to place. If you're needing to use it, you'll want to thaw it or kind of lift that freeze while you're trying to apply for new lines of credit. The example I always tell people is I had to get a new car. So went in to those websites, you lift that freeze, whatever day it is that you need to go take care of that. And then once you've applied for those car loans or credit card loan, whatever it is that you need to do, you can then go back on the website and put that freeze back in place. And again, it will just kind of lock it back down so nobody else is able to use that credit in your name without you knowing it or without you intending for that credit to be opened and used in that way. And you will need to kind of reach out to each of the 3 credit reporting agencies to do this. So you can go to their websites. It's a pretty quick process to do. So you go to their website, just click the button on there that you want to put a freeze in place, and then it's put in there. Again, it's free to do, and it will kind of put a lot of that security measures in there for you, and you can lift it or thaw it anytime you want to. If you're doing it online, I believe they have like an hour to put that thaw in place once you need it. Like in my example, I did it before I left the house, and by the time I was at the car dealership, that thaw was already in place. They were able to run my credit, take care of that, and then when I got back home, put the freeze back in so nobody else could access that credit. So it's a really great tool that you can use to protect your information. And if you think you've been the victim of identity theft, any type of identity theft, not just medical identity theft, you can let SCDCA know. Our phone number is right there on our graphics. 1-800-922-1594 is our toll-free line. It does require a South Carolina-based area code to be able to access that. But you can also go to our website, consumer.sc.gov, and we have our identity theft forms there as well. And you can let our identity theft unit know that something's going on, and they can kind of help walk you through that process. One of the things that they do is they've got a toolkit that they can send out to you, and it kind of walks you through steps that you might need to take to stop damage, things you might need to do to be able to kind of repair your credit reports, things like that. They have a checklist with all of this that will really kind of walk you through. A lot of it you have to do yourself. I know a lot of times people want us to just take care of it right away, but they have that checklist that will go through and let you know which accounts you need to contact, things that you might need to consider doing in order to prevent further damage from happening. Here's kind of the second page with that, and it kind of looks at things that you would need to do to dispute any errors, block things from showing up on your credit report. And again, just kind of let our identity theft unit know what's happening, fill out our report form on consumer.sc.gov, and they can kind of walk you through a lot of this. And this is a little screenshot of that medical ID theft step-by-step form that I said. If you haven't downloaded that and you believe something like this is going on your accounts, we've got that form right there on the side of the screen in our handouts section. So you should be able to download that. If for some reason you can't, you can go to the consumer.sc.gov, and then under our identity theft unit tab, you should be able to find these listed on that page as well. We've got a couple of others. They'll go through things like tax identity theft and things like that as well. So no matter what type of identity theft you might be going through, we've got little step-by-step forms like this that you can find on that website, and it'll kind of walk you through on things that you might need to do to correct those errors that are showing up on your records. We appreciate you joining us this week. We hope you'll join us next week for our next Wednesday webinar, and I hope you have a good rest of your day. Thank you.